Examiners are very fond of asking this question. What is enucleation? What is evisceration? What is the difference between the two? Enucleation is nothing but removal of all the three coats of the eyeball. The eyeball, entire eyeball is being removed, cutting the optic nerve. It includes the outer fibrous coat, that is sclera cornea, the inner nervous coat and inner vascular coats. Everything is removed, eyeball is removed in total. So this enucleation is done in case of tumors of the eyeball. One is retinoblastoma, another thing is malignant melanoma, or sometimes when the eyeball is severely traumatized, the eyeball is being removed in toto. Why in case of trauma, the eyeball is removed in toto? In severe trauma, what happens is, because of the trauma in the eye, the other eye sometimes may develop sympathetic ophthalmitis, which may lead to loss of vision in the other eye also. That is why in severe trauma, the eyeball sometimes is being removed. The other thing is evisceration. What is this evisceration? Evisceration is removal of inner two coats of the eyeball only. The optic nerve with the sclera is left back. Only the inner vascular coat, that is the choroid, ciliary body, iris. Next is the inner neural coat, that is the retina. Next is vitreous and lens. Along with the cornea is removed. That is called as evisceration. When an evisceration is being done, evisceration is usually done in case of panophthalmitis to prevent the spread of infection from the eyeball into the skull through the optic nerve, so that evisceration should be carried out. Or in case of bleeding staphylomas, we know that it is the ectatic cicatrix of the outer coat of the eyeball with incarceration of the uveal tissue. In case of anterior staphylomas caused by corneal ulcers, it will start bleeding even for small traumas. That eye may be blind also. In such a case, we have to do evisceration so that the patient is getting rid of the symptoms. What is the advantage of evisceration over enucleation? The advantage of evisceration over enucleation is the sclera is left behind, the optic nerve is there, the muscles attached to the sclera are also there. So, if you put a ball inside that scleral cavity and recreate an artificial eye, you can get a cosmetically better eye in a person. It may not have vision, but for a cosmetic reason, when people see from outside, the face will look normal. That is why evisceration is better. But we cannot do evisceration for enucleation's indications. We cannot do enucleation for evisceration indications. So that also you should understand. I have pictorially drawn this. Enucleation. You can see the optic nerve which is being cut here and the eyeball is not present. Here, the optic nerve and sclera are present, nothing is present inside, including the cornea. Another important question people are fond of asking is, what are the commonest indications for enucleation? When do you do a bilateral enucleation? Answer is one. One is in eye donation following death, both eyes are removed. That is being commonly done throughout the world. That is the commonest indication. Another important thing every student should be aware of is excentration of the orbit. Excentration of the orbit is a common topic that was discussed during this COVID-19 period. Many patients underwent excentration of the orbit. What is the reason? It is because of the infection by mucormycosis. Mucormycosis, which is spreading from the nasal cavity and sinuses into the orbit. It causes blindness in the patient. It not only causes blindness in the patient, from the orbit, it may spread to the skull, causing death of the patient. So, as a radical treatment, they did a combination of FES. They did an excentration, that is removal of the eyeball and all the contents of the eyeball, including the lids and the adjacent skin if needed, leaving behind only the orbital bones. That was being done in this COVID-19 period. Apart from this, excentrations of the orbit were done in case of local spread of orbital tumors or neighboring structure tumors. A retinoblastoma or a malignant melanoma spreading out of the eyeball into the orbit, in order to prevent their extension further, excentration was carried out. With this, I will stop here today. We will discuss about some other topic in the next session. Thank you.